The COVID crisis tested Europe's healthcare systems, where countless lives were saved, but others were lost, in part because of a lack of cross-border coordination. The EPP Group's Esther De Lange witnessed it herself.
My grandmother at the time was in a care home in the Netherlands, yet only 5 kilometers away from the German border. And at the time we had quite a big outbreak in Germany, relative quiet in the Netherlands. So they should have been on the same level of alert and they should have been cooperating much more than they were.
De Lange's grandmother passed away at age 100, not of COVID, though others at the nursing home did.
Our personal story when it comes to COVID shows that a virus doesn't stop at the border. The worries of families doesn't stop at the borders.
That's why the EPP Group is pushing for a true health union to tackle cross-border health issues within the EU, to better coordinate healthcare and medical supplies, with greater roles for the European Medicines Agency, the EMA, and the European Centre for Disease Prevention and Control, or ECDC, and through creation of the European Health Emergency Preparedness and Response Authority, or HERA. The patchwork reactions by EU countries during the COVID crisis also blocked families from seeing each other. De Lange is among a group of parliamentarians looking at lessons learned from the COVID-19 pandemic.
I had a father on the phone who couldn't see his children for months. A divorced couple, one of the parents living in Belgium, the other one in the Netherlands. Belgium closed the borders. What do you do as a family? So this can be done much better in the sense that if the situation across different borders is comparable, is equal, your measures need to be comparable as well.
There is an EU cross-border patients' rights directive, but more needs to be done for families, says the EPP Group's Tomislav Sokol. He says some fellow Croatians do get medical care in other EU countries.
So these are usually children with congenital defects, usually heart defects, where we just don't have experts in Croatia who can perform surgery. And the surgery needs to be performed in a very short period of time, in most cases.
But Sokol says there are problems with the current rules, like paying health care costs up front in another country.
Which is pretty problematic for people who just don't have enough resources to pay the entire treatment cost from their own pocket and then ask for reimbursement.
That, he says, needs to change. Another issue is the need for free flow of data across borders, especially in a medical emergency in another EU member state.
The medical doctor in that state needs to know whether they have underlying physical health conditions. And this is why exchange of data, exchange of health data, electronic health records is crucial if we want to have really common European health data space.
The free flow of data, patients, and medical supplies across the EU, part of a common European health space or health union that spans internal borders to save lives.